Welcome, everyone, to the 8th webinar in our 23-24 webinar series. Thank you all for being here. And this is being recorded, and we hope to be able to deliver the recording to you in a week or two. And just thank you so much for being here. Tonight, we have, or the first thing I'm going to do is introduce Casey McKenna, who works with the National Fabry Disease Foundation as our resident genetic counselor. And she's managing education programs and community support and assistance programs. And so Casey is going to introduce Joanie Vignovich to you, who is speaking for Sanofi tonight on patient care programs and resources. So Casey, if you'd like to introduce Joanie, that would be great.
Thank you, Jerry.
Certainly.
Okay, excellent. So we are very pleased to have with us today Joanie Vignovich. She is a patient education liaison, or PEL, with Sanofi, where she works in the rare disease division. As a patient education liaison, Joanie works to educate and support individuals and their families throughout Georgia who have been diagnosed with a lysosomal storage disease. Prior to joining Sanofi, Joanie worked as a genetic counselor at the University of Pennsylvania and then at Emory University, specializing in reproductive genetics. She then moved into the pharmaceutical arena, working at Integrated Genetics, formerly Genzyme Genetics. We are so glad to hear Joanie join us today. And I'm excited to hear what she has to say. Please note, you can ask questions at any time in the chat box and we'll read them at the end. All right, with that, welcome, Joanie.
Thank you, Casey, and thank you, Jerry, for having me. I'm going to share my screen with you here. Well, thank you again. Yes, I just want to talk to you a little bit tonight about some of the support programs we have here at Sanofi, the biggest being the Care Connect Patient Support Services and how that impacts and affects the patient's journey. So we like to support the patients here at Sanofi all along their journey from beginning to end. If you look here, there's basically 3 different topics tonight, and all results back to the Care Connect Patient Support Services. The first is to introduce this program and what it means. The second is to understand how this program can support families throughout their journey. And the third is actually to provide some information on other programs we have here at Sanofi that supports patients as well. And my toolbar keeps getting in my way. Sorry about that. I'm trying to switch slides. There we go. Individualized support for patients with rare diseases is really primarily what we care about and what we're all about here at Sanofi. The Care Connect Patient Support Service Program represents Sanofi's more than 35-year commitment to supporting the rare disease community. Whether a patient is newly diagnosed or has been on treatment for a while, the team here works really closely with them to give the patient all the support they need. The program is confidential, it's free, it's voluntary, and really it's personalized. We look at each patient's journey as being a unique journey, and we want to help them, just support them along the way to overcome any challenges they have related to living with a rare disease. Comprising the program, really there's 2 people. The main one is the case manager, and the other one is me, or patient education liaison. We look at the different roles we have, and the case manager role is very, very different than the patient education liaison role. Your case manager is your primary point of contact. If you have questions related to insurance, reimbursement, access to treatment, they are happy to help you with any of these issues. They provide the care coordination when you start treatment, or if you stop and then you resume treatment, if there's any site changes or changes in treatment, any insurance changes, people change insurance at the new year, or sometimes they move. Your case manager is always the one that's available to help you with that. They're expert in health insurance and navigating the healthcare system. And they really assist with how to handle any out-of-pocket costs. Or sometimes we have patients that don't have insurance or have lost their insurance for various reasons, and they're the ones you would talk to with any of those issues. The main support the case manager can provide, again, is for insurance coverage. Benefits can be very challenging, and case managers really have the ability to verify the benefits for the patients. They can educate the patients about any insurance coverage they have. They connect patients with all different resources, whether they be local resources or national resources that may be available. They speak with different care facilities, different sites. They provide assistance to finding a facility with experts who may understand a patient's journey and their specific healthcare needs. And those physicians and those sites help best manage various conditions. And so we're really appreciative that they have the ability to find those sites for the patients. We also offer multilingual services, and really case managers and patient education liaisons work together. I'm seeing a patient next week who, his whole family speaks Spanish, but he speaks English primarily. So I'm meeting together with a Spanish speaking case manager, and we're going to speak with that patient together. We can meet with that patient in person. We can do it over the phone to provide interpretation services. Spanish is not the only language that we can provide interpretation for. We can always use any other services as well to be provided for any other languages. The other part of the Care Connect patient support service team is the patient education liaison. PEL is really the point of contact for education, to educate patients and their families either virtually or in person, for disease education, treatment education. A lot of times we go into schools or we talk to employers. People with Fabry sometimes have some issues, and schools need to understand sometimes why students need to take more bathroom breaks, or employees need to understand why patients may need a day off to go get an infusion. So we really want to help educate the community about Fabry and what it means to those patients to have the flexibility and the understanding in their workplaces and in their schools. PLs can also help you understand how the disease is passed on through families. We talk a lot about inheritance, and one of the main ways to look at inheritance is to create a medical family tree. This is really a presentation and a schematic of what your family looks like, who may be at risk, who may not be at risk, how the disease is passed through the family. Those trees can be done by PELs, sometimes they're done by physicians. They can be done virtually or even in person. And it really is for the best way for any type of patient to look at their family tree and really get a good picture of the family at large. Most PELs, those at Sanofi, either have a nursing background or a genetic counseling background. As Casey said, just like she is, I'm a genetic counselor. And what's different about the PELs and the case managers are PELs are regionally based, which means I live in my territory. I cover primarily the state of Georgia, where most of our case managers live in the Boston area, close to the corporate office. So how do we connect with PELs? How are we there to support you? Basically, we're there any way you need us to be. We can help you understand health conditions, not only of yourself, but also of your child or another family member. We can review symptoms. We can talk about the medical monitoring that physicians may choose to provide. We can talk about various treatment options. We meet with our patients in a host of different ways. A lot of times we speak to them over the phone. We may have Zooms or virtual meetings. I personally like to do a lot of face-to-face meetings, sometimes with patients alone, sometimes with their families. I try really hard here in Georgia to see my patients as much as I can during the year. Sometimes that'll be an individual meeting, sometimes a family meeting, and sometimes a big group meeting. We can offer a lot of education to the patients, new patients, as well as patients who've been part of our program for many, many years. There's a lot of treatments that change through the years. There's new products that come on the market, and there's a lot of questions from these patients about what's available. So we are happy to always discuss with them treatment options and to provide them with the most up-to-date knowledge we have. We also talk about training and product labeling, safety. Safety is a major component of any Sanofi program. We give one-to-one education about home infusions. I train a lot of home infusion nurses on how to safely and correctly deliver a medication to a patient. We talk to the patients about what it means to have an infusion if they're a new patient and what the infusion journey is going to be like for them. And then again, we work with those families to understand inheritance. Inheritance genetics can be very, very confusing sometimes. And just by understanding who in the family may be at risk, what it means to be at risk, just like what it means to not be at risk. Sometimes the people that are not at risk are also really important to talk to. And we use tools such as a medical family tree to help identify the family members and really just sometimes help identify who needs the education other than the patient we're speaking with. So what are the steps a patient takes along the journey to receiving care? The first is to enroll in the CCPSS program. And there's various ways they can enroll. They can enroll by receiving an application from their healthcare provider. They can sometimes contact us directly. Sometimes I've enrolled patients at a family meeting that they've just happened to attend, but yet they weren't yet part of our program. After a patient is enrolled, the first thing we do is we try to meet with them within the first week of enrollment. The case manager, the patient education liaison, we tend to do a joint reach to the patient, either a joint call or a joint virtual meeting. And then I try to meet with the patient in person during that first week. We provide them with any other forms they need. We provide them with educational materials. We review the collaterals we have at Sanofi with them so that they understand the mode of inheritance, the disease characteristics. We have a long talk with them about what their current needs are and what they think their ongoing needs will be. Every journey is different, so every patient has different concerns. It's really important to just kind of meet them where they are and talk about, what are your concerns now and what do you anticipate going forward? The case manager verifies the insurance benefits. Together, we talk about potential sites with the healthcare providers. Where would it be best for this patient to receive their care? Do they have transportation issues? Is it better to try to get them care near their home? So we talk about all of that as steps along their journey. The paths they take are very different, and each patient may have different challenges throughout their journey. They may have a treatment change. They may have a provider or a physician change. Sometimes their site of care changes, specifically if their insurance will change, sometimes their site of care changes. Sometimes a patient moves or changes location. I'm meeting with a patient tomorrow that just moved to Georgia from Alabama, and although she's been on treatment, she has a lot of questions about what treatment's going to look like in a different state. Their insurance changes a lot, usually at the beginning of the year if they change jobs. So a lot of these different changes we address sometimes multiple times with the patient. Whenever they need us, we're there to help them with any of these challenges. So first you enroll, this will be scenario 1, and then you meet with the team, which again is your case manager and your patient education liaison. We provide them with the appropriate materials to read, the appropriate forms to fill out. We take a family history if they would like a family history taken. We review the family history with them and give them a copy of that family history. We talk about their current needs. Behind the scenes, the case manager is verifying insurance, and then we establish the site that they're going to receive their care. In scenario 2, we talk about the changes that can occur. We're always going to meet with them as soon as we can. Even if they've been on treatment, we like to meet with them every year. But then there can be some roadblocks. Are they able to make it to their appointments when they need to? Do they have insurance changes? Has something changed in their family? Are they having a baby? So there's a lot we talk about when it comes to roadblocks or the needs they have specifically. We then always verify their insurance. And then we establish nursing, site care, and which pharmacy they will be receiving their medication from. Again, we train all these site nurses for home infusions. And then our area business managers go out to the sites themselves if a patient's receiving an infusion at a primary location, an infusion center, and trains the staff there. So before a patient ever receives their infusion, everyone involved is trained on the mechanism behind the infusion and how to correctly administer the infusion. We provide the education, we secure prior authorization for everyone, and the final step would be that the patient receives the care they desire. So what happens if there's an insurance change? Well, that may mean a lot of things for a lot of different patients. It may mean your nurse may change. A lot of times patients are very, very happy with the nurse they have at home. They've had the nurse for a long time, and they don't want to lose that nurse. So we try as hard as we can to keep patients with the nurse they've had if possible. But insurance may dictate which nursing facilities take that insurance. We may have to verify the new insurance. We may have to discuss other types of financial resources or financial assistance that's available to people. We want to make sure our patients receiving the care at the best location for them. So we always secure prior authorization, provide the education, and make sure the patient gets the care that they so need and so deserve in the manner that is easiest for them. So Care Connect Patient Support Services. This is a summary of how we can support you throughout your journey. We provide in-person or virtual education, not only to newly diagnosed patients, but to all patients that are around, whether they've been around for many, many years or new to treatment. We like to update them with education, talk to them a lot, meet with them several times a year if possible. We always provide them with disease-specific literature and resources. Some of those are websites, some of those are paper materials. We talk about what it's like to start treatment or changes in care. We make it easier by doing all the behind the scenes insurance verification, providing the treatment educations, providing providers with education if needed, and assisting with site of care coordination. A lot of times we not only provide education to their genetics physicians or to their healthcare providers, but we may speak to different providers, nephrologists, neurologists, etc. When a roadblock arises, such as a missed dose, we check out why. Why is a patient missing a dose? Is there something we can assist them with that they just don't want to tell us about? Maybe they need us to switch clinics for them. Maybe they need a different schedule. So we always want to reach out if we see for some reason a dose has been missed. We reauthorize assistance. Claims and billing support is always available for these patients. And if they're traveling or moving, we help find treatment centers and resources related to their home infusion. If they're moving to a new state or even a new country, we try to make sure that it's as seamless as possible for them. They find out where they can go. Vacation, we always try to help. We had a patient go on vacation last year for a month to Europe, and she was able to receive her ERT while she was away. And any other logistical challenges that are related to their care, we hope to address through the Care Connect PSS program. And then again, family history. We provide them family medical trees, genetic testing, diagnostic labs. It's amazing sometimes to see patients when they actually look at their family tree and can see, just drawn on a piece of paper, what it means or how big or how small their family is and who would be at risk, who maybe they should even talk to first about getting tested. And then insurance changes. We help navigate through all the insurance changes related to employment, marital and dependency statuses, age transitions, or other eligible matters that are related to the patient's care. So other than CCPSS, which is really the main program that the case managers and the patient education liaisons work through, we have other unique patient programs here at Sanofi. One of them is called a Perspectives program. And this program really arose when patients informed us that they want an opportunity to talk to each other. They may have gone to meetings where they heard a physician speaker. They may have gone to meetings where they've heard a patient education liaison speak. They really want to share what their challenges are, how it is to be with a genetic disease, to live with a genetic disease, what it's like to care for someone with a rare disease. And they really wanted to speak to each other. So that's how the Perspectives program came into play. Perspectives Plus adds a little bit more to that program. There's a whole other dimension to it. And it really talks about health literacy and health communication. How can a family talk about their health information, their disease with other family members? What words should they use? Whom do they talk to first? Why should they share the information? And what should they share? You know, should they share it to a big group of family members? Do they share it one-on-one? Who would be the first person they should talk to? So that Perspective program is really, again, patient-driven. Patients are talking to patients, coming up with solutions about the best ways to really discuss their family's journey with other family members. Relatively Rare is another program we have. It talks about the foundations of a family tree. It raises awareness about lysosomal storage diseases in a family, discusses family history, the importance of medical family trees, the importance of speaking with family members about lysosomal storage diseases, and then again, tips for having those conversations. What words should you use? Who should you talk to first? And then the last program we have is called Expressions. And Expressions is really an innovative program that was designed to explore and develop creative coping strategies. This program may center around drawing one evening. It may be an art project. It may be painting, something that allows you to sort of escape and cope in a different way by expressing really what your thoughts are, your desires, just on pen and paper. Other unique programs we have are the Journey Ahead programs. And there's two different types of Journey Ahead programs. One is Journey Ahead, a resource for young adults. And this is a program that really the case managers and the patient education liaisons tend to do together. It was designed for patients between the ages of 16 and 26. And really, these are the transitional years. They're the years where individuals, patients are transitioning from childhood to adulthood. And how do they do that? We want to empower them to make informed healthcare decisions. It may be as simple as don't forget to carry your healthcare card with you. It may be more complex into here's who you need to find, here's the doctors that you need to find when you go to college. Make sure you have a primary care physician while you're at college. So it's really a nice program that really helps them, you know, branch out on their own, make their own decisions, call for their own doctor's appointments. I'm sure moms and dads have been doing them for a long time, and now we want to empower them to go ahead and make their own appointments. The Journey Ahead Transitioning to Medicare is a program for people with disabilities or end-stage renal disease who are turning 65 and people who are eligible to switch to Medicare. This program supports those individuals throughout the process, signing up for Medicare, what it means to have Medicare, the restrictions and the pros associated with Medicare. And then we have a patient speaker bureau programs. There is when we actually hear from you, our patients and family members, about your own personal journey with living with a rare disease. You know, no one's the expert except the patient that is there. And so it's great for us to always hear your journey, the solutions you've had, the challenges you've had, and other patients appreciate hearing that as well. And then we have other Care Connect patient education programs. They range on a very, very wide range of topics. We give one on self-care. We can provide one on the schedule of assessments with Fabry disease. There's a lot of different programs available just within the Care Connect framework. We also have digital resources. We were talking before, we're in a digital age now. So if you want to hear from the Care Connect PSS community about any unique journeys with a rare disease, you can go on to www.careconnectpss.com. We have podcasts where you can listen to patients, caregivers, or HCPs talk about discussing rare diseases, part of the life journey of living with a rare disease, what it means to have a rare disease. And then there's various webinars that look at the stories of patients at different stages of their life, how they handled transitioning to college, how they handled having a job when they had a rare disease, starting a family, what it's like to have to create a support system. Who is your support system? It's always good to have a support system and some. So really, we try to have a broad program of topics and really support patients, families, caregivers all along their journey. You know, I've seen so many patients throughout my career here at Sanofi, and I've seen them in one-on-one meetings. I've seen them in family meetings. Sometimes we've seen them just by PS-led programs. And really, every meeting allows me to learn something different from a patient about their journey. And not only are they learning from us, but we're also learning from them. We're always just a phone call, a text, or an email away. And I really mean that. You know, whether your needs are large or small as a patient, the Sanofi Care Connect PSS team will work closely with you. We'll provide you with the confidential and personalized support you need. We're there to answer tiny questions. We're there for major life changes. We just want to support you in your journey and make sure that you're receiving all the support and the care you need. We know it's difficult to live with a rare disease, and any support we hope is welcome. If you ever want to reach your Care Connect PSS case manager, the number is going to be 1-800-745-4447, and then option 3. You can always email us at info@careconnectpss.com. I think that is the end of my slides. So I'd like to open it up for questions. I'll turn it over to Casey.
Thank you very much, Joanie. Great presentation.
Thank you, Journey. We have a comment in the chat. We don't have any questions quite yet, so please go ahead and enter them now. But someone is saying that they had infusions when they were in Bangalore, India, thanks to the case manager's help. That is so remarkable.
Yeah.
That's cool, Joe.
Yeah, thanks for sharing.
Yes.
Good to see you. So, Joanie,
Yes.
all of the programs that you mentioned are all accessible from the website, the Care Connect website?
So not all the programs are on the website, but when you reach out to a case manager or to a patient education liaison, we can inform patients of when the programs are and make sure they have the ability to attend.
Okay. And there is also another a Sanofi patient website, isn't there? That
There's a lot of different patient websites, sure. I mean, the best thing to do is always look at the main website, and that will get you a directory to the correct person who can lead you to any programs that are available. But we have most of our programs listed. And we do programs quite often. You know, we do regional programs, we do national programs. There's a national program next week. I do a lot of regional programs, as do all of the PELs. And sometimes we do them with other states. Like I'm doing a program, it's in Georgia, but we invited the Alabama folks that live close by or the Tennessee folks that live close by. So we try to get as many programs out there as we can. And I would always encourage any patient or family member to reach out to your local patient education liaison. They can always provide you with information about the national meetings and the local meetings.
Great.
And sometimes you never know. I have a patient who lives really far from my meeting next week, but her daughter lives a half hour away. So she's arranged to visit her daughter so she can attend the meeting. So you never know who's going to attend a meeting. You know, they may be traveling and be in the area. There's a lot of different ways to get the information. So we always want to make sure you have the opportunity if possible.
Great.
And Joanie, can I ask you for the number again to contact a Care Connect manager?
Sure. It's 1-800-745-4447. And it's option number 3.
Okay, and I just put that in the chat box in case anyone is looking for that number. And it looks like we have a comment that, you know, it would be helpful for everyone, not necessarily just, oh, I texted that just to you, would be if we could talk a little bit more about home infusions under Medicare. And if there was anything that we as a community could do to possibly get that change to move forward.
It's a good question. I think all of us would like to see a change in that. I mean, I have a lot of patients who really, really wish they could do home infusions. You know, they're older, they want to stay closer to home. It's difficult to go out. Um, I don't know how to make that change other than to kind of talk to the insurance companies, tell them what's important. You know, tell them that's a really important factor. I think it is for everybody. You know, regulatory agencies are out there. It's really hard to change laws sometimes within the Medicare system, but I think that's one that we all wish was a little different for our patients.
There are some initiatives, ongoing initiatives to change that. And so we hope that someday soon that it does change. But you're right, it's a difficult thing to change those.
It is.
All right.
Okay.
Well, with that,
Now-
if we have, sorry.
I was wondering, Joni, if I could ask you a question. You
Sure.
touched earlier on, possibly having meetings about what a kid with Fabry, a child with Fabry disease might need to know before a school setting, or what their teachers or their camp counselors might need to know. Can you tell us about any resources or best tips or tricks when trying to, work with the school or camp?
So I do a lot of school and services, and really, you know, they appreciate the information. I will tell you, I think they're just not knowledgeable. You know, they work in their field and they have sort of their blinders on, and and all kids look alike, and Fabry children look wonderful and perfectly normal. And so it's hard sometimes for them to understand that they have burning feet because they can't see that as a symptom. You know, it's hard for them to understand they have GI issues. So I really go in and we have a slide deck that talks about, school and services and what it means. And I've had to say, you may have a 504 plan set up, and we don't do any of that. That's not a Sanofi product. We don't do 504s, but they may have it set up already. And, what does it mean for this child? This is why they need a bathroom break pass, even though they went to the bathroom 4 times already in this hour. They need to go again. And this is the reason why. And we just try to provide them with as much education as we can, because they don't know, and we want them to know. The more information we can provide to anybody in the community, the better. And I'll tell you a little personal story. I did a school and service once, and it was the student and their parents, and it was the staff and the nurse and the principal. And then suddenly the superintendent walked in. And I was a little surprised, to tell you the truth. And I wasn't sure he even knew I was coming to the meeting. And he was wonderful. He didn't say anything. And afterward, he came up and he said, "Thank you so much for doing this. My child has cystic fibrosis, and I wish this happened when they were little." And so it really, I think it made the parents think, and I think it made the staff think that, you don't always see what someone's going through. And I saw the comment, positive, negative. You are right, positive or negative. These kids look perfectly normal. And so it's hard for someone in a school or even in a workplace to understand that special accommodations might be needed.
Thank you, Joni. That's a great story.
So,
All right. If there are no more questions, thank you very much again.
sure. Thank you for having me.
We will have a prize drawing. So I've got my random number generator ready. So if everyone would put Sanofi in the chat box, and we'll give you a minute, and then we'll do our drawing. And this part pertains to only the people who are the primary attendees, which are people with Fabry disease, family members, and caregivers.
And you can click the chat button at the bottom of your screen and enter the keyword, which, as Jerry said, is Sanofi. And then everyone who writes that down will have a even chance by Jerry's random number generator to win a gift card.
And while we're waiting, we'll just we'll share a little trivia. So when Genzyme became Sanofi, because it's a French company, some people started saying Sanofi, as Casey does. Oh. So I was back and forth all the time. I changed from one day to the next until I asked Dwayne Clark what he said, one of the big guys in leadership in Sanofi. And so I asked Dwayne, he said, I say Sanofi. And I watched some webinars or meetings that Dwayne talked in, and he said Sanofi. So I decided that I'm going with Sanofi, but we still, I think either is still correct. So Sanofi goes for the flare on says Sanofi, but I just thought I'd share that trivia with you. All right.
I flip-flop too, Jerry.
Yes. You say Sanofi?
I say Sanofi, and then I think sometimes when I hear people that work for the company in Europe, they say Sanofi. So
Yeah.
I flip-flop too.
I decided when I heard Dwayne speak, because if somebody in that high leadership position in Sanofi is saying Sanofi, I'm saying Sanofi. But it really doesn't matter. So what, how many, Brittany, how many people do we have in the chat box?
We have 6.
So we have 6 people that we're going to enter, ask for a number in the random number generator from 1 to 6 and say generate. And number 2, who is number 2?
That'll be Jane Ferris.
So Jane, congratulations. We will send you a $50 gift card. And that is all for everyone tonight. So thank you all for being here, and we'll see you next time. The next webinars are the similar program with patient care programs for Chiesi and for Amicus, and then we'll move on to some other subjects. So thank you all for participating. Good night.